thank you, as always, for your really strong collaboration, which is a cornerstone for, excuse me, for our response. I will start off by a very simple exercise to be sure that we get the right appellation of the Africa Centers for Disease Control and Prevention. And in this day and age where we go by the abbreviations, I'd like to be sure that I share with you a little quick correction here. The Africa Centers for Disease Control and Prevention is known in the abbreviated form like Africa CDC. And it is not CDC, it is not a CDC, and it's not CDC Africa. It is Africa CDC. I say this just to differentiate between the Africa CDC brand versus the US CDC, the China CDC, the EU CDC, and the other CDCs around the world. So I'm calling on you all to help protect that branding and the name of the Africa CDC, given that we are young in our own lifespan. So let me switch over to the epidemiological situation. As of 9 a.m. East African time, today, 16th of April, there were a total of above 2 million cases of COVID-19 reported across the world. And of that number, 120,000 about have unfortunately died. And again, as I said last week, this is an extremely dangerous virus, replicates very quick, and is a very vicious virus in terms of transmission. You may ask, what is the situation on our continent? As of today, this morning, about 17,200 individuals have been infected on the continent, and these cases are reported from 52 member states. This is last week when we met. The cases were 46% lower than it is today. So you can see that we have almost increased by 50% the number of cases from last week to this week. The number of deaths as of today stands at 910 with 3,546 recovery, which is a good thing for us to celebrate. The question is always asked, which are the countries that have are reporting the highest number of cases now? We have in the first 5 countries include South Africa with about 2,500 cases, Egypt 2,500 cases, Algeria 2,100 cases, Morocco 2,000 cases, and Cameroon about 850 cases. Let me now just shift your attention to and take you a little bit down into the number of how we are seeing the deaths here. If you compare what we call the fatality rate, which is of those who are infected, those who die, what proportion does that represent? It is at about 6%. And I think we are seeing in some countries that this rate is higher than the global, what we see globally there. Let me now shift your attention to our response. What have we done since the last time we spoke with you? In partnership with the World Health Organization and the World Food Programme and the Ethiopian Airlines, we are in the process of supporting the distribution of the second shipment of medical supplies that came from the donation between the Jack Ma Foundation and the Prime Minister of Ethiopia, Prime Minister Abiy Ahmed, and that distribution has already started. And in terms of the content, we receive about 950,000 virus transport media. These are solutions that they use in collecting the specimens from the patient or the individual for testing. We receive a similar amount of reagents that are needed to extract the genetic material of the virus from the specimen. We also receive about 190,000 medical disposable protective clothes, that is gowns. We receive 190,000 face shields, and 456 ventilation machines. We also receive about 1,800 temperature scanners, 475,000 medical gloves, and those are being distributed aggressively as we speak. This is very important for the protection of our of our healthcare workers as well as individuals on the front line. We continue to work with screening to increase member states' ability to support member states in their diagnostic capacity. At this point, I would like to make an important announcement that going forward, starting next week, we are going to launch an initiative called Partnership to Accelerate COVID Testing, which will be have a tagline of Test and Trace. Again, I'll repeat slowly: Partnership to Accelerate COVID-19 Testing, in abbreviation PACT, P-A-C-T, with a running title of Testing and Tracing. This is important because, as I explained last week, there is a big gap on the continent on testing. So we will be rolling out, as Africa CDC and African Union Commission, more than 1 million tests in the coming 1 week to 1.5 weeks to support countries so that they can increase the ability to test and also increase the ability to trace individuals. We shall also be accompanying this initiative by a community healthcare workers program that will support countries, especially those at the top, that I mentioned, the 5 or 6 countries that have the highest rates, and other countries that are struggling with what we call a community healthcare workers program, where we believe that using the community will increase our ability for contact tracing. And I'm also very pleased to announce that the first partner in this initiative, in the PACT initiative, is UNAIDS, the United Nations AIDS Joint AIDS Program. And the Executive Director, Winnie, and I spoke at length yesterday, and she is extremely supportive, and UNAIDS will join forces with us to expand community reach and contact tracing on this program. I think that is very, very important. The fundamentals of this is that there are 4 things we need to do if we have to have a fighting chance in the coming 4 weeks to beat back the virus on the continent. One is scale up testing and isolate the infected individuals, trace them, and make sure that we find out how the virus is spreading in the community, especially now that we have lockdowns going on in the countries. Second is we have to protect our healthcare workers as much as possible. It will be a disaster if our healthcare workers are not protected deliberately upfront. It means there will be a lot of nosocomial infection, and it will be difficult for them to support other treatments across the continent. We know the shortage, the acute shortage of healthcare workers that we have on the continent. We cannot afford to lose them to COVID-19. Thirdly, we'll be focusing on communities. We'd like to make sure that the communities' response is strong. We shall only be effective with contact tracing if we have a strong community response component. That is where the UNAIDS comes in. And fourthly is commodities. We need a constant supply chain management to feed the entire response spectrum there. I think those are the 4 pillars that we will be looking at going forward and working with you all. The Africa CDC is also working on what we call the genomic sequencing network as part of the task force. What does this mean? It means that we will be building on reference labs around the continent where we can analyze the full genome of the virus and understand the patterns, how the virus is circulating in our member states and on the continent, so that we can trace it to the source of the outbreak and use that to sharpen our response strategies there. Let me just switch on to other things that we are doing. 466 clinicians have attended our last webinar training on clinical community of practice. That is, this is a community that will help manage the patients there. 56 surveillance experts from 23 member states have attended the last two trainings for community surveillance. Again, they will help with our efforts of the testing and tracking there. People have always asked what is the situation of treatment. Now, as we speak, there are 4 clinical trials for COVID-19 treatment registered on the continent, and they include a chloroquine clinical trial in South Africa, a solidarity trial for remdesivir, chloroquine, hydrochloroquine, lopinavir, and interferon beta in South Africa. So the first 2 are all in South Africa. In Nigeria, we have an aspirin, losartan trial going on in Nigeria, and lastly in Egypt, natural honey treatment. These are registered trials, which means that we are tracking those. We have a record of what they're doing. They have a scientific protocol that has been read carefully and reviewed and approved by an ethical committee there. So in terms of clinical strategy, Africa CDC is mapping out the medical equipment dangerous virus, replicates very quick, and is a very vicious virus in terms of transmission. You may ask what is the situation on our continent. As of today, this morning, about 17,200 individuals have been infected on the continent, and these cases are reported from 52 member states. This is, last week when we met, the cases were 46% lower than it is today. So you can see that we have almost reviewed and approved by an ethical committee there. So in terms of clinical strategy, Africa CDC is mapping out the medical equipment capacity on the continent. Our records show that
Good morning. Good morning.
You can see that we have almost increased.
Good morning. Good morning from Addis Ababa. Good morning. Good morning from Addis Ababa, from the headquarters of
Emphasizing that the restriction in movement imposed by countries may be having inconveniences, mainly in the socio-economic effects, but the long-term gain are incomparable. There is always a pain before gain, and that is a price that we have to pay to contain this virus, which we must, as I've said earlier, win the battle against this virus in order to survive. I encourage everyone to continue to stay safe and to continue to spread the message, the right message in the communities, especially join us to fight false information, fake news, and misinformation. Thank you.
Thank you so much, Dr. John. We now cross over to you, our colleagues in the media, who might have questions to put forward. And already we have some that have come in. Let me start by going to our WhatsApp thread and take the first question, which is coming from our friend Emmanuel Egunzi. And Emmanuel is with BBC Africa. His question is about South Sudan. And he says, are you concerned with the country's ability to deal with COVID-19 due to the effects of wars and conflicts that have left the healthcare system devastated? That is part one. And then he has a part two, which says, how are you helping the country deal with coronavirus with such strained resources? Those are two questions from Emmanuel Egunza from BBC Africa.
Thank you, Emmanuel, and good to hear from you again. And I've enjoyed your reporting from Kenya. For South Sudan, of course, like any country in Africa, we are very concerned with the ability to cope with this. Let it be very clear that the Executive Council, in their communique 2 weeks ago, specifically asked us to pay attention to vulnerable populations and also to fragile states, and not just South Sudan, but other countries in Africa that will be challenged. I've made this very clear, and I'll repeat it. COVID-19 will not be defeated anywhere on the continent except it's defeated everywhere on the continent. So that includes South Sudan and any other country that might not have the capacity. So it is a collective responsibility. The battles will be fought locally, the victory will be won globally or regionally as a continent. So South Sudan, South Sudan is receiving all the commodities to fight the COVID that we have distributed. We are on our second round of distribution now with the support from the Prime Minister Abiy and the Jack Ma Foundation. So they are receiving their shares and as well as much as possible. They are supported through the testing that we've provided. They are doing their testing of COVID in Kenya. And we hope that with time, they will build that capacity very, very quickly in Sudan, in South Sudan, excuse me.
Thank you very much. Our second journalist is from the Portuguese news agency, Lusa, and she's writing from Lisbon. Her name is Cristina Ferreira, and she says, I have two questions. I would like Director John to address refugees' situation in Africa regarding the pandemic. What are his main concerns? What is this Africa CDC plan and guidelines for this segment of the population? This is the part A. Then the part B is, has Africa CDC received requests for support from the 5 Portuguese-speaking countries in Africa? What kind of support has been requested? medical supplies have already been sent to these countries, what medical supplies and in what quantities. So she has a number of questions as question 1 and 2.
So let me start with question 1. The refugee situation is of concern to us because we truly don't want the virus to seed into vulnerable populations. And as you heard me mention, the Bureau of the Executive Council has expressly asked that we pay attention to that, and we will be developing guidelines for that. We haven't, but we will be developing, guidelines on that and specific programs that will target those vulnerable populations there. I think that is, and we'll keep you updated. With respect to the 5 Portuguese countries in Africa, we've treated all countries as we speak equally. All countries were provided training. I mean, as you know, about 48 countries on the continent can test for COVID-19. That also includes the Portuguese-speaking countries. We trained them all in a group. And we have distributed reagents, including 20,000 tests to all countries, including the 5 Portuguese countries. So, and we continue to provide online training in other areas there, including the 5 Portuguese countries. So I believe that that everybody on the continent so far has been treated equally. Now, going forward, some of our efforts will be targeted to those countries with the highest disease burden. I just mentioned at the start of my briefing and gave you a list of 5 countries that were on the top. That was Morocco, South Africa, Egypt, Algeria, Cameroon. And as the pandemic changes, we'll tailor our support to that, to those countries that will be heavily affected. In other words, if a country has 8 cases, there is absolutely no reason why that country should have 1 million tests, and you are not probably using it. And then a country that has 2,000 cases and is struggling to test the contacts, it will be in short supply. We have to show understanding and solidarity across the board. So I think going forward, some of it, and we really wish that the situation doesn't go escalate, so that we can at least cope with the support that we are providing. But that going forward, the support will be tailored to against the burden of the disease.
All right, and the final question that I have from WhatsApp before we go to those who are joining us live is coming from Tina, and Tina is with CCTV. She's asking about a Chinese medical team that will arrive today. And the question is, will there be cooperation between Africa CDC and the Chinese medical team? And also, what does the Africa CDC think about this style of cooperation?
We are aware that a China medical team will be arriving in Ethiopia. We have been briefed on that. We are also aware that a similar team has been to Nigeria. And we are also in discussions with the China medical team in Ethiopia, if we can meet with them and understand some of the areas and that of support that they bring to bear. We also are in touch with the China CDC. Just yesterday, I was in touch with the director of China CDC to make sure that we learn some lessons from China CDC on how they are handling or how they handle this outbreak. So the point I want to make is that there are a lot of lessons that we need to learn from China because they've dealt with this. I keep reminding you that we are in the morning of our outbreak. China is on the sunset of the outbreak, so it makes sense for us to learn from China as much as possible with respect to how they handle this, especially in terms of case management, of treating the patients and how they did that and what they are seeing now.
All right, thank you so much. The next question is coming from Irene Escudero, and she's with the Spanish news agency. She says, you are announcing that starting next week, there is going to be more than 1 billion tests done. What are the deadlines, and do you already have the availability of all these tests? Where are they coming from?
So let me just repeat. I said, today we are announcing an initiative called the Partnership to Accelerate COVID Testing in Africa, with a tagline of Test and Trace. As we speak, we have in our disposition 1 million tests that we've ordered from Germany. It's the same source that we have been ordering the tests from Berlin to support countries. Remember, in our previous briefings, we said when this outbreak was just starting, we trained countries in Senegal and South Africa, and we have rolled out more than 80,000 tests. Now we are escalating that through using the same reagents. It's 1 million tests, not 1 billion tests. Okay, and the key word there is partnership. We see this as a movement, and we count on the media, the community to partner with us, and of course the private sector and other funding entities to partner with the AU, Africa CDC to drive this initiative there. We all know that the rate limiting step for the continent has been testing, so something has to be done to promote that testing, and we as Africa CDC, with the limited resources that we have, are saying we are putting out 1 million tests. We'll push that agenda aggressively. We are looking for partners to support us in this, not just funding partners, but the media has to join us in these efforts. I mean, and use the tagline, test and trace, as much as possible. So the tests are there. We will roll them out. Now, you may say, well, how many tests do we need for the continent? Over the next 3 months or 6 months, we probably need like 15 million tests. However, a journey of 1,000 miles starts with the first mile. Let's start with the first mile. And to show the impact of this, if we see what is going on, going on the continent in terms of testing, I can give you some numbers. South Africa, with a very aggressive testing strategy, is reporting about 80,000 tests so far. 80,000. Ethiopia, a country we are in here, is reporting about 5,000 or less than 5,000 tests. Nigeria, similarly, a country of 200 million, reporting about 6,000 tests. So if we say that this is that testing number and we increase it by 1 million, that will be a significant jump, okay, and requires a concerted effort. It would not be a quick thing, but it is exactly because it's difficult and challenging that countries have not been able to scale up the testing. So if even a 1 million test can go a long way to boost this testing, it would have been a very, very important contribution. Yeah.
Thank you so much. Can I just remind those who are watching us on our live stream channel that should you want to ask your questions, you can put them forward to WhatsApp number +251 945 502 310. We move on now, and we come to Neil Munshi, and he's with the Financial Times. He's asking a question which, Dr. John, you've dealt with before, but let us repeat it. And he says, can you talk about how Africa CDC and African countries are dealing with competition from wealthier nations for equipment, supplies, tests, etc.?
I think, first of all, let me approach this from a much higher level and say that we fully understand the challenge the world is facing. We also understand that it is the responsibility of each member state to ensure the health security of its citizens. So that should be clear that if I were the leader of country X in the West, I want to secure the safety of my citizens. It is also the responsibility of each member state in Africa, or for their leaders, to ensure the health security of their citizens there. Having said that, we should never forget that no country will be declared safe of COVID-19 if we still have COVID cases circulating in Africa there. It will be a waste of time and waste of resources and a very naive way of looking at the problem there. So it means even when commodities and supplies are in short supply, we should make sure that the globe should make sure that Africa has its quota to support the response, because it's a global fight and requires global action and global solidarity, as I've said. So I think that is very important. That way we complement efforts and not compete for the resources there. Now, as I said earlier, the situation will gradually change on the continent, and I hope quickly, when local companies manufacturing in Africa will kick in. We know that there are companies in South Africa, Egypt, Ghana, Cameroon, and other places, I believe, that we are doing an inventory of this, that are switching on to do local manufacturing, and I think that will begin to ease some of this, the needs to rely solely on China to get us what we need. So it's work in progress. This is not a situation the globe was anticipating. We've always dealt with situations where an Ebola outbreak in West Africa or DR Congo occurs, and then we rush to the West China to get supplies. But we're faced with something that the world has never dealt with for the last 100 years, where simultaneously we are faced with a common enemy and we are fighting it collectively.
All right. Tawengwa Jacob Sipapate, he doesn't say which agency he's with, poses a question about security personnel, police, military, etc., who are coming into contact with the public. And are they not influencing the spread of COVID-19 in how they're handling crowd control?
They should be. That is a very good question. I mean, my advice and strong recommendations to the countries is that the security officers, using that word very broadly, should be trained first on how to protect themselves and protect the public. And they should also be trained in non-violent methods in controlling the population. I think I say this very strongly, that and believe in the human rights component of this struggle. We are in a struggle, and we have to make sure that in as much as we are in a haste to win the battle against, and the war actually against this virus, we protect the rights of individuals across the board. Where that requires that when the security officers are out there to control the population, enforce some of the lockdown, you do that with and keeping in mind that there are human rights issues. We also know that some people are being stigmatized. Those are human rights issues. We should address those. We also know that people who have recovered have suffered stigmatization and discrimination. Those are human rights issues. So I think I'll put that underneath the whole realm of ensuring that we place human rights in our ability and capability and our drive to respond to this war we are fighting.
Tom Wills of Deutsche Welle says the Imperial College of London published a research paper on March 27th, which suggested that without mitigation measures, almost 4 million people may die in the course of the pandemic. Does the Africa CDC believe the model is a useful prediction of the possible future scale of the coronavirus epidemic in Africa?
I'm happy that that's an extremely important question, which we are looking at all the models that are being developed. The Imperial College is one out of several groups that are doing modeling, and we are reviewing that as Africa CDC to look at the models that may best explain our scenario. Let me just explain that modeling is based on assumptions, and it depends on the kind of assumptions that you put in there, into that. That paper you just described, I've seen it, and there are 4 different scenarios that they are putting in there. I think the worst case scenario is where not enough is done or nothing is done, and a continent of 1.3 billion people is infected, and then what will happen to that? But something is being done. I think we are social distancing. You can see that I'm 2 meters away from Wayne, and we've shut down the AU, and people are working from home. So These other measures that have happened will mitigate that assumption and will factor into that assumption there. So we don't know what we don't know. There are so many parameters on the continent that will play into a model. For example, the youthful population of the continent, about 70% of our population is less than 30 years old, and that may be a factor. At the same time, we know that it's a continent that has a high burden of endemic diseases, that is tuberculosis, malaria, and HIV, and other underlying situations like malnutrition. We just don't know how this will factor into it. And the lockdowns that we are seeing and the closures of borders, we also don't know how that is going to fit into the model. So I think let's be careful when we throw out numbers, but rather use the numbers to plan and allocate our resources as much as possible.
All right. Julia Paravicini of Reuters says, when does the Africa CDC believe the apex of the virus will be for Africa? Do you have any dates? Also, is the difficulty in retrieving data from member states hampering the response and preparedness plans?
I think we are, first of all, we have to unpack Africa as a continent and know that, there are certain countries that we will definitely have more clean data that we can use to predict when it will peak. And so it will be extremely difficult to have a general model that shows that the continent will be, as a whole, will peak. So we are as Africa CDC, actively working with the different groups, different modeling groups to see which countries will peak based on the data that we have. It's the prediction will be as good as the data that we are receiving from the country. So it's a drive and a push that we are encouraging ministers of health who sit on a coordinating committee to reach out in their respective countries and help us have that data so that we can do appropriate projections and predictions as to when we'll peak and when we can see ourselves coming down. But I want to caution that it will be extremely difficult to have a general projection for the entire continent.
All right. Next, we have a question which is coming up through our WhatsApp thread, and this one is coming from Wisdom Mudzungairi, and he's with Newsday in Zimbabwe. He has 3 questions. He says, our concern right now is on the support for the positive cases. With no support, they are flouting self-isolation rules and going out to search for food. And he gives a case that he quotes from Zimbabwe. So his question then would be, can there be guidelines on medical custody for such? And even, is there mandatory quarantine? This is the first part. Secondly, he says there is still uncertainty on the use of masks. There is actually more harm if they are used incorrectly. This is his belief. Is there a clear guideline on this? And there are too many conflicting views, he observes, saying that some countries are saying that people should wear masks all the time, and others are saying you only wear it if you are sick. So what is the guideline for people? Then the last question is on lack of resources, which is hampering efforts to slow down the impact of COVID-19. And he then asks, what can be done to help weaker African states?
So those are 3 very important questions and extremely timely and useful. Yeah. So with respect to the support and for those infected, we have, I think, every country and member state know what the recommendations from the World Health Organization and Africa CDC is. Clearly, if you test positive, you have to go into isolation, and you stay there until you clear the virus. Some of the cases are mild cases, okay? Have mild symptoms, as I say, and that you can actually be isolated at home, and you get over it. Some cases require that you go to the hospital and get medical care and stay there until you are tested negative. That is, your test is repeated over and over, and you become negative. The last case scenario are those that really are in dire need of respiratory support, and those people cannot move around. You really are required to go into intensive care and for your treatment there. So my reflection there is simple. The recommendations exist. We should apply ourselves to those recommendations as much as possible. The war against COVID-19 also has to be individual. That everybody has to ask themselves the question, what am I doing in terms of self-discipline in order to contain this virus, which is in two dimensions, to protect myself and to protect the other person. I think that is a moral responsibility that is imposed on all of us. It is not about what will happen to me, it is about what will happen to the other person if I do not behave properly, if I do not respect the guidelines that are being put out there. We can produce zillions and zillions of guidelines, but if they are not respected, implemented with discipline at individual level, it becomes very difficult. That is why in our continental strategy, we highlight 4 things. One is cooperation, which means we cooperate across not just member states, but with partners. We cooperate with the community, and we cooperate even within their own behaviors. How do we behave so that it's easy? We collaborate. We coordinate our efforts, and we communicate. Those are the underpinning of our strategies there. So cooperation, both at individual level, country level, and global level, is so important. Second question about masks is, yes, we should use masks. And this week or early next week, the Africa CDC will issue guidance on masks and how to use it appropriately. And I'll repeat that. We will be issuing guidance on masks and how to use it appropriately. I see people putting on masks for a while, then the next time is below their chin and on their heads or in their... So it doesn't work. I think we have to use it appropriately. And I think that there's some evidence out there that says that if we use it massively, we can at least protect the droplets. I'll just be very specific that it doesn't need to be the surgical mask. We should not be going out after those surgical, because you create a shortage. I mean, we need those ones in the hospital settings there. And the guidelines that we produce will say that we can make masks ourselves. It's get a simple piece of cloth, do it, attach it, especially when you are going into a shopping center to buy food. Because at any rate, we still have to go out in the market and buy food, right? So we cannot starve ourselves. So if you put that, one thing it does is that it stops the droplets. Okay, as we speak, sneeze, cough, there are droplets there. So if you have even a basic cloth mat, it shields you from that. I think that is what we should be encouraging, and we'll put that in guidelines. So again, don't go after the surgical mask, because there are healthcare workers and doctors who need that. The last thing is the lack of resources. We all understand that as a continent, we are not a resource rich continent, and even within the continent, we are at very, very different levels of resources there. And I know that different bilateral organizations are helping. The World Bank is supporting member states directly. Other bilateral agencies are doing that. I know that the Global Fund just allocated $500 million that they'll be using to support some COVID response exercises. We also know that the World Bank and the IMF are conducting some debt relief so that they are easing the pain on the countries. In other words, if country X was supposed to reimburse $5 million this month to a donor, they can delay that for a couple of months. I think that will create the ability to have the resources, the funding or financial resources locally to respond to the outbreak. So resources, of course, is a cornerstone to fight this war. You can only win a war if you have the appropriate resources. And that is why my appeal continues to be global solidarity. We work closely with our partners, the global funding agencies and donors, to support those countries in Africa that are in dire need of financial resources to support the response.
The next question is coming from Kerry Cullinan, and Kerry is with Open Democracy South Africa. She says there have been reports that prices of some of the medicines involved in trials have been increased by manufacturers. Is this true? And if yes, what can be done about it to address it? Then she goes on to give an example, which I'll just read out very quickly. She says, well, I'm not sure that I should be mentioning the names of specific companies, but the general question is that prices are going up.
They have not, it's not an area that we've done an analysis to give you evidence. I can only base this on anecdotal stories that we are hearing. And we will be looking into this to find out what countries are seeing. But from a strictly sociological and behavioral approach and reflection, that you expect that there will be people or companies, organizations that want to take advantage of this crisis and make profit is something that we as an organization, a public health agency for the continent will strongly condemn and discourage. Because this is, first of all, a humanitarian crisis we are dealing with. So we'll continue to do our homework and find out what countries are seeing and reporting, and we will make it known to the public if we know companies that are behaving not appropriately.
Thank you for that. Let's move on. And we come back to Neil from the Financial Times. He says most of the equipment, supplies or tests coming into Africa so far have come from the Jack Ma Foundation. How does what his foundation has donated compare quantitatively to what Africa CDC has been able to procure itself? And which groups or countries or organizations have donated equipment and supplies?
So the thing is, countries that we cannot account for bilateral donations because we just don't know. We don't have that. We are not privileged to that information from the countries at all. And neither do we want to actively look into that because, I mean, countries are free to do what they want to do. I know that countries are working directly with China. I know that countries are working directly with some European organizations. So I've said this over and over, that Africa CDC has intervened in 4 different areas of the response, both in preparedness and response. The diagnostics, I think we've made a significant impact in the area of diagnostics. We're very quick in recognizing that we are dealing with an infectious disease, and we will not win if we don't know how to diagnose it. So very quickly, we ramp up testing from 2 countries to 48 countries, and we've since distributed over 80. That is procured and distributed over 80,000 tests. I think that is, and we supported the distribution of about 1 million tests from the Jack Ma Foundation. So it's not just the Jack Ma Foundation distribution, but our own distribution. Second, the whole area of training countries to have the ability to surveillance. This all has to do about tracing, contact tracing. So we very early on train and continue to train people using all different platforms on surveillance, on how do you do enhanced screening and surveillance. We did, I think, 29 countries in Kenya very early on. Thirdly, we have been working with Nigeria as a co-lead of our infection prevention control arm of our strategy to train over 40 countries on infection prevention control. It's extremely important in this fight because that is where most infections will occur, and we are very pleased with the way it's going. As we speak, we have a team of 3 people in Nigeria cascading that down the spectrum. We have a team in Côte d'Ivoire and a team in Cameroon supporting them to cascade that down the spectrum. We did a training on risk communication in Tunisia, where we brought, again, almost close to 35 countries and trained them on risk communication, and then we've since been supporting them with different aspects for that. So I say this to say that a response is not just commodities. So if the Jack Ma Foundation is focusing on the commodities, then we are focusing on other technical aspects. That way the two complement each other. So it's it doesn't make sense that if we had those to distribute, we say, well, we will not distribute the things from the JAGMA, we only go out for our own things there. It is part of the continental response, which calls on this cooperation piece that I mentioned there. We deployed 7 people at the airport for a week during during the first distribution exercise, and without that, we wouldn't have been able to move the distribution within 1 week across there. So I think our efforts has to be synergistic, not necessarily what we can do as an organization, but what we are supporting and cooperating with others to do.
Sam Eferero from Africa Health Times in Nigeria asks the question that I've heard quite often. Is total lockdown of countries really the only way out for us in Africa with our peculiar health and economic challenges? Are we not likely to have more problems even after COVID-19, with countries telling citizens to stay indoors but without food, money, etc.?
The whole lockdown exercise is one that is unfortunate, but a necessary intervention, because it has serious economic impact. It has serious restriction impact, especially when we know that our economy is driven mainly by the informal sector. People have to go out and hustle to get to survive. We find ourselves between a hard place and a rock, because if we do not do the lockdown, the virus continues to multiply and we will have a lot of deaths. I mean, let that be very clear. I want to share some numbers with you. The first, by the 4th of March, the United States has reported less than 500 cases, and with almost limited death. But by the 4th of April, there were more than 15,000 deaths in the U.S. I mean, so I say this to say that let's imagine a large city like Lagos, that if lockdown doesn't occur and the virus penetrates quickly and spreads, that I think you can do a simple maths for yourself and see the impact in terms of the deaths that will occur. Any life lost across the world on our continent is a severe loss to humanity, and we're taking that seriously. Let there be no doubt that this is going to impact our economies very, very seriously. There are projections out there that says that in Africa, about 9 to 15 million jobs may be lost after this pandemic is over, if it's over soon. So let it be very, very clear that this is, again, it has a serious economic implication. Our leadership, the ministers of finance and the head of states are calling for an economic stimulus packet of about $100 to $150 billion to support our economy. So your question is very valid. We are more focused on the health side, but there are ministers of finance and economy looking at the economic impact of this on our continent.
All right. The next question is coming from someone who hasn't given us their name, but they ask the question that the Asian continent's strategic deployment of technology resources combined with massive tests helped mitigate the adverse effects of COVID-19. And the question then is the Africa CDC willing and ready to accept such collaborative efforts if available?
Of course, yes. That is a cornerstone of our strategy. Is one of the principles is collaboration and cooperation. I think we already know that Ghana is deploying, and it has an app that they will be using soon or maybe they are using it already to track people with symptoms and other things. So I think that is that. Technology is always welcome and will be critical in this response. The massive testing is what we are driving through the effort that I just announced, the PAT, that is partnership to accelerate COVID testing, is part of that exercise to really scale up testing as much as possible. If you don't test, you don't find. So that is simple principle of fighting infectious diseases. I mean, in a very cynical way, the best way to not know that an infectious disease is there is not to test it. If you don't test, you don't find anything, and you can assume that you don't have it. So I really count on all of you to support us in our aggressive or accelerated testing campaign.
All right, so that question was actually coming from BD. The next question is coming from Kenneth Methu. And Kenneth asks, what are your thoughts on the use of remdesivir, plasma, and hydrochloroquine for therapeutic interventions? Have you implemented any strategies to control asymptomatic patients?
So the strategy for asymptomatic patient is not a medical strategy. It's the kind of non-medical strategies that we are all implementing. Like, I can see in this room that most people are more than 1 meter apart. So that if someone is asymptomatic here, we know that physical separation can help. In terms of those drugs that you mentioned, that I indicated at the start of this briefing, the drugs that we know that are in a registered clinical trial. And that means that they've gone through an ethical approval process in country and a scientific approval process in country, and they are considered to be sound. And which means the interest and the safety of the patient is protected. Others may be doing testing, but it's not recorded. I mean, they may be doing trials, but it's not recorded there. The drug that you mentioned, chloroquine, we've issued guidelines, not guidelines, guidance that says that you should only take that when you are enrolled in a trial. The advantage of that is that they will monitor the side effects. If you're having some side effects, these are drugs that have side effects, including those that can affect your heart. So we want to be sure that you are monitored. If you are captured in a clinical trial situation and you are taking that drug in that context, then that trial can monitor. But if you just buy it off and you're taking it at high dosage, it may actually end up killing you. I think that is very clear. With respect to the other drug, there is under a clinical trial, and I think the results will be exposed in the next coming weeks. And we are already in discussion with Gilead, who produces that drug, to understand and get ourselves ready in case the drug will be found to be efficacious and safe. We will use it on the continent.
All right, we are fast running out of time. We have about 5 minutes to go. But let's take this question from Balu from Sierra Leone. Will you be tracking the impact of using antimalarials for COVID-19 trials on the incidence of malaria in Africa, particularly in areas where malaria is prevalent?
We will be tracking those studies that have been registered as official clinical trials. There is not much that Africa CDC can do about country X if they are administering malaria, anti-malaria treatment massively there. And if we don't know it, we don't know it. And that much we will not be able to track that. But any country that is doing that as part of an official trial, we will, of course, keep track on those.
All right, thank you very much. I can see that we have colleagues who are online, and I'm wondering how we can get your questions through to us. There's a colleague who's been on standby for quite a long time. If I can just ask our technical team to advise us how we can support the colleague. Hello, can you hear us? Hello? There's a gentleman who's been on standby for quite a long time. Can you hear us? It seems like we're not connecting with you, colleague, but I'm aware that you've been on standby for a long time. If possible, please quickly send us your question to +251 945 502 310. I think that's the best way that we can help you because we cannot connect to you. So while we just wait to check and see if you can send us your question, I'll just ask Dr. John to see if you have any final comments on the situation.
Well, my final comment is that of cooperation. I really would like to reiterate what I said earlier, that we are at war with this virus, and we need all the support and cooperation that is required. And especially from the media, we would like to work with you very closely to promote this initiative we are announcing, which is a partnership to advance COVID testing so that we can at least achieve our goal of testing, tracking, and isolating the patient. We need your help as much as possible to be aggressive in your messaging to the community because the community listens to the media, and I think they will align and they will lend their support to this initiative that we are launching, which is will be extremely important for us to, in the next coming weeks, to have a chance to fight this infection.
All right, we have time for one more question, and this one is going back to Julia of Reuters. Will the funding cuts to the WHO affect the Africa CDC work in Africa or the Africa preparedness and response? And if so, how?
It absolutely will affect the member states' ability to receive the support from WHO. WHO is an important global partner, and is the body that we all look up to for guidance and support. So the cut in their funding would definitely impact the ability of countries to respond adequately.
Thank you very much. That was Dr. John Nkengasong addressing issues from the media. We started off with a summary of the epidemiological situation on the continent, and then we took some questions from our colleagues in the media. We may not have been able to get everyone to ask their questions, and we apologize for that, but this is a regular occurrence. We will be back on air on Thursday next week at 11 a.m., and that is East African time. If you have something very urgent during the week, please feel free to reach out to us on that WhatsApp number, and I'll give you that number again. It is +251 945 502 310. In concluding, I'd just like to reiterate what Dr. John said at the beginning of this press conference, and that is for us, please, as colleagues, to make sure we use the correct acronym for the Africa CDC. We do often hear it being referred to as the ACDC, which, if many of you have long memories, was a rock band, or can be a form of electricity current, but the correct acronym for the Africa Centers for Disease Control and Prevention is Africa CDC. Even as I'm answering questions here and I'm putting them to Dr. John, I'm having to say Africa CDC, even when colleagues have said CDC. So please let us try to make sure that we call it by its right name, which is Africa CDC. Thank you so much, Dr. John. Thank you.
Good morning, good afternoon, and good evening. Tomorrow, WHO is joining forces with many of the world's leading musicians, comedians, and humanitarians for the One World Together at Home, virtual, global, special. This is the result of a close collaboration with my good friend, Hugh Evans, from global citizens, and the inspirational Lady Gaga to bring entertainment, joy, and hope into the homes of people all around the world whose lives have been turned upside down by the COVID-19 pandemic. I would also like to use this opportunity to thank Lady Gaga's mother, Cynthia Germanotta, who is our Goodwill Ambassador, who is doing a great job advocating for mental health around the world. And thank you so much, Lady Gaga, and thank you so much, Cynthia Germanotta, for your continued support and help. This is a family project, and we really appreciate for your commitment and dedication. This is an opportunity to express our solidarity with frontline health workers and to mobilize philanthropists, the private sector, and governments to support the COVID-19 Solidarity Response Fund, powered by the United Nations Foundation and the Swiss Philanthropy Foundation. So far, the Solidarity Response Fund has generated more than $150 million from more than 245,000 individuals, corporations, and foundations. These funds are helping us to buy personal protective equipment, lab diagnostics, and other essential supplies for the countries that need it most. So I would like to say thank you. Thank you so much. Thank you from our heart to those who have contributed. For further details about tomorrow's events, I'm delighted to welcome once again my friend and my brother, Hugh Evans, to say a few words, to be followed by the amazing Lady Gaga. Hugh, over to you.
Thank you very much, Dr. Tedros, and thank you, members of the press, Your Excellencies, ladies and gentlemen. I'd also like to acknowledge Lady Gaga, who has played a leading role in curating One World Together at Home. During tomorrow night's special of One World Together at Home, you will see the worlds of music and policy come together to celebrate and support the dedicated and essential work of frontline community health workers. Whether it's the doctors, the nurses, or the lab practitioners, these are the real heroes in responding to COVID-19. Their sacrifices day in and day out deserve to be honored and supported. And so that's why we've been calling on citizens everywhere to use their voices to take action to ensure we all have access to testing, to all have access to vaccines when they're available, and all can practice social distancing. We've also been calling on philanthropists and the private sector to step up in support of the WHO's Solidarity Fund and local charities who are supporting the most vulnerable people around the world. Because we know that the most vulnerable in our communities must not be forgotten. And above all, we want to ensure that the frontline community health workers have the equipment and the support they need to fight this disease. The COVID-19 pandemic has highlighted why international cooperation is more important now than ever. We must solve global problems with global solutions because we know that a virus anywhere can lead to a virus everywhere. And our mission, and at the heart of what we're wanting to achieve through One World Together at Home tomorrow night, is ensuring that our global health systems are strengthened in the future to prevent a future pandemic, so that the poorest and most vulnerable in our societies are protected. No generation should have to endure the pain and suffering we've all experienced around the world over these last few months ever again. That's why we are proud to work with our partners and relief organizations to support communities affected by the COVID-19 pandemic. The money raised tomorrow night will go to support both local charities and also efforts to provide PPE to community health workers around the world. Face masks, protective equipment, gowns, goggles, the things that they deserve. Our healthcare workers deserve our support. And we know that if we all do our part, we can weather this storm. At Global Citizen, we're so proud of what's been achieved in a few short weeks with One World Together at Home. Since we announced the special, we've received phone calls from Mongolia to Iceland, from South Africa to India, Brazil to Korea, asking how people can support the effort to ensure we can reach as many people as possible. This is a moment of true togetherness. And we are honored that on Saturday, thanks to the outpouring of support, One World Together at Home will be accessible to billions of people around the world. From Asia to Africa, Europe to the Americas, the special will be broadcast in over 100 countries, and it will be accessible across the entire world on digital and audio platforms. This will be a true shared experience, and we could not have done this without the support of the WHO team. Special thanks to Paul Garwood and Gabby and the communications team for their tremendous partnership. And I'd also personally like to thank the executive producers of the special, Michelle Anthony and the team at Universal Music, Bobby Campbell, who works with Lady Gaga, Declan Kelly and the team at Teneo for all of their efforts to rally the artist community, philanthropists, and the private sector in support of COVID-19 response efforts. It is now my great pleasure to welcome our friend and partner in ending this crisis, who I want to sincerely thank for all the time, energy, and effort she has given to this. Ladies and gentlemen, please welcome Lady Gaga.
Thank you so much, Evan. Hugh Evans, you're wonderful. I'm really speechless at how kind everyone is on this call today. Thank you so much, Dr. Tedros. I can speak on behalf of not only myself, but my mother as well. We deeply appreciate your partnership. And yes, it is quite true. We all know the importance of the mental health support that the medical community will need during this time and after. It will be extremely crucial, and we are already getting ready. Thank you, Hugh Evans. You are a superstar at Global Citizen. Thank you for your continued leadership. And this fight against COVID-19 is one that the whole world will fight together. Over the last week, I have witnessed an inspiring and fearless global effort. While watching medical workers continue to battle the front line of this pandemic, leaders, other nonprofits, artists of many mediums, and people of all nations have combined forces to write a love letter to the world. We call it One World Together at Home. It is a love letter to our doctors, a love letter to our nurses and other healthcare professionals who are risking their own lives for the sake of ours. To the delivery drivers, grocery store workers, factory workers, public transportation workers, postal workers, and restaurant workers doing the same. We celebrate your bravery and your heroism. During this time, we have seen the coming together of a singular, kind, global community. This triumph has instilled in myself and my colleagues a true calling to call upon the private sector and philanthropists to commit millions of dollars to support the World Health Organization's COVID-19 response. To name a few of dozens and dozens of donors, we now additionally have donations from Procter & Gamble, Johnson & Johnson, Citi, Coca-Cola, Target, the Ford Foundation, Rockefeller Foundation, and Bloomberg Philanthropies. Updates are such that we are now at $50 million and counting in contribution to the fund and to local community-focused charities. When we launched this with you all, 12 days ago, the world was in a different place. And 12 days from now, the world will be different again. We hope for the better. We also hope that though tomorrow night's event one world together at home, we will continue this, telling global stories of triumph and hope, and told to a global audience, truly bringing the world together. We can do something to bring joy and respite to the corners of the earth. With that, I am pleased to share with all of you some news that the Rolling Stones have joined the lineup of artists performing tomorrow. Let's keep the momentum going. Once we see this tomorrow night, this will not be the end, and I will still be taking your phone calls if you wish to donate. Let's keep our joy. Let's remind each other that this is a kind world. We are excited even more to announce more donations tomorrow night. Thank you, thank you, thank you from the bottom of my heart to all of the healthcare workers around the world. Dr. Tedros, you're truly a superstar. Thank you so much to the media for telling the stories of all of these medical professionals and getting the word out about how under-resourced their systems are. And to all the global citizens out there for supporting this effort. I'm Lady Gaga. I'm an Italian-American patriot. But I'm also a global citizen. Thank you.
Thank you so much, Lady Gaga, and thank you, Hugh. I look forward to joining you and millions of people all over the world tomorrow for what I am sure will be a wonderful event. And I share what Lady Gaga said. What the world needs is love and solidarity. So please accept much gratitude and much love from myself, Lady Gaga, and Hugh Evans, and all our colleagues here. That's what the world needs. Again, what the world needs is love and solidarity to defeat this dangerous enemy. More than 2 million cases of COVID-19 have now been reported to WHO, and more than 135,000 people have lost their lives. While we mourn for those we have lost, we also celebrate those who have survived and the thousands of people who are now recovering. WHO is updating our guidance to include recommendations for caring for patients during their recovery period and after hospital discharge. We're encouraged that several countries in Europe and North America are now starting to plan how to ease social restrictions. We have said previously that easing these measures must be a gradual process. And we have spoken about the criteria that countries should consider. Yesterday, we published our guidance on considerations in adjusting public health and social measures, which we encourage countries to read and apply. But although we see encouraging signs in some countries, there are worrying trends in others. In the past week, there has been a 51% increase in the number of reported cases in my own continent, Africa, and a 60% increase in the number of reported deaths. With the current challenge of obtaining testing kits, it's likely that the real numbers are higher than reported. With WHO support, most countries in Africa now have the capacity to test for COVID-19, But there are still significant gaps in access to testing kits. We're working with partners to fill those gaps and help countries find the virus. The African Centers for Disease Control and Prevention announced yesterday that more than 1 million tests for COVID-19 will be rolled out across the continent starting next week. Strengthening and supporting African Union institutions like the African CDC will really help, not only for now, but also for future. To further strengthen support for Africa, earlier this afternoon I spoke with President Ramaphosa of South Africa, the current chair of the African Union, and Moussa Faki Mohammed, the chairperson of the African Union Commission, UN Secretary General Antonio Guterres, the managing director of the International Monetary Fund, Kristalina Georgieva, and the president of the World Bank, David Malpass. In addition to tests, we're also working hard to accelerate the development, production, and equitable distribution of a vaccine. Yesterday, I spoke to President Emmanuel Macron of France, Bill Gates, and other partners to discuss how to prevent another pandemic by getting vaccines from labs to people as fast as possible and as equitably as possible. The commitment from President Macron, from Bill Gates, and also from Prime Minister Boris Johnson is heartwarming. I also spoke to the Prime Minister of Barbados and the current chair of the Caribbean countries about the challenges faced by small island developing states in gaining access to test kits and other supplies. No country should be left behind. And I would like to use this opportunity to appreciate the strong leadership by the Prime Minister of Barbados steering the response in the Caribbean. Today, I also spoke to the President of the European Commission, Ursula von der Leyen, and the Prime Minister of Finland, Sanna Marin, about continuing efforts across Europe to fight the pandemic and support lives and livelihoods. The commitment from both leaders, President von der Leyen and Prime Minister of Finland, Marin, is very, very heartwarming again. I would like to clarify WHO's position on wet markets. Wet markets, as you know, are an important source of affordable food and livelihood for millions of people all over the world. But in many places, they have been poorly regulated and poorly maintained. WHO's position is that when these markets are allowed to reopen, it should only be on the condition that they conform to stringent food safety and hygiene standards. Governments must rigorously enforce bans on the sale and trade of wildlife for food. WHO has worked closely with the World Organization for Animal Health and the Food and Agriculture Organization, FAO, of the United Nations to develop guidance on the safe operation of markets. Because an estimated 70% of all new viruses come from animals, we also work together closely to understand and prevent pathogens crossing from animals to humans. Finally, WHO is committed to keeping the world informed in as many ways as possible, in as many languages as possible. Our Viber chatbot is now reaching 2.6 million people with reliable evidence-based information and is available in 16 languages. This week, we launched Tamil, Sinhala, Bulgarian, Greek, Italian, and Hungarian. And we plan to launch Polish and Bangla next week. I'm pleased to say that from Monday, we will be providing simultaneous interpretation for these press conferences in all official UN languages: Arabic, Chinese, French, Russian, and Spanish. And we are also planning to expand to include other languages like Swahili and Hindi. We look forward to having more journalists join us from all over the world. I thank you.
Thank you very much, Dr. Tedros. Indeed, this is a great news that we will have this press conference in other languages, and therefore many friends around the world will be able to join. We will now open the floor for questions. I will remind the journalists to be brief if possible and to ask only one question, so we try to get as many as possible. So if we are okay, we will start with our friend Bianca from Globo, from Brazil. Bianca, can you hear us?
Yes, Tariq, can you hear it? Can you hear me?
Yes, please go ahead, Bianca.
Yeah, the question is to Dr. Tedros. The Brazilian President Jair Bolsonaro fired his health minister, Luiz Henrique Mandetta. They were clashing over the response to the new coronavirus, especially about the stay-at-home recommendations. And Bolsonaro said that life is priceless, but the economy and jobs must return to normal. I would like to know how concerned are you, Dr. Tedros, with the situation in Brazil, and what message would you like to send to the country?
Yes, we are aware that the President of Brazil changed his Minister of Health today. We'd like to thank that Minister for his service to the people. It's key, though, that not only the government of Brazil, but that all governments take an evidence-based decision, have a whole of government and have a whole of society approach to responding to COVID-19 pandemic. We all have a duty to protect our most vulnerable populations. PAHO, our Regional Office for the Americas, has been supporting Brazil in preparedness and response to COVID-19 since January this year, and is helping Brazil to purchase millions of PCR tests to expand diagnostic capacity, with the first batch scheduled to arrive next week. We want to focus on providing operational and scientific support to Brazil through our Regional Office for the Americas, PAHO, and to do that consistently and without fail in support of Brazil and all countries in Central and South America and the Americas as a whole.
Thank you very much, Dr. Ryan. Next question, we go to Shanghai Media Group. That's Bin Chen, if I'm pronouncing correctly. Can you hear us, please?
Yes, thank you.
Yes.
This is Bin Chen from Europe, correspondent from Shanghai Media Group. Greetings from Berlin. So yesterday, the Austrian health minister said that Great Britain's rate of new coronavirus infections frightens a lot of people in Europe if we compare the new cases of the UK to the other 7 European countries. So is WHO aware of the sharp rise in the UK, and what can we learn, like other European countries can learn from that? Thank you.
Didn't hear your question very well, but I think in general you were talking about the differences in numbers in different countries in Europe, and I think all countries have gone through and are in different stages of their epidemics. It is not useful to compare countries at different stages of their epidemics. I think we see countries have passed a peak or arriving at a peak, and some countries are considering lifting of restrictions and some others not. And I think all of those decisions have been taken carefully. We've advised very clearly that countries need to make those decisions with great prudence. They need to walk back and move back and transition from measures associated with large societal measures, lockdowns, shutdowns, that needs to be done. But it needs to have in place 3 very important things: One, a completely empowered, educated community, capable individuals who are aware of the physical distancing, the personal hygiene measures that are needed to avoid infection. Communities aware and involved in the process and fully empowered to act and participate. A strong and acceleration and strengthening of the public health capacities for finding cases, for testing, for isolation, and for quarantining of contacts. And this is exceptionally important. And our colleague Tom Frieden in the US has likened this to, we need to start boxing the virus in, not boxing people in. And I think it's a good analogy. We need to start finding the virus, because right now, with the current situation, everybody is locked down in order to stop the virus spreading. The only way we get to shift away from that is finding the virus and then limiting the measures as best we can to those individuals who may have the potential to spread it or may have the potential to develop the disease. And the last part of that is having a strong enough health system, that the health system has recovered enough and has enough capacity built in that it can react. And you're seeing many countries are starting to bring online measured transition. Nobody is removing themselves from a lockdown type situation in a dramatic way. You'll see countries are phasing the response, and they're trying to look at the measurements they're going to use. And what we do appreciate is that countries are leaving time. They're taking some measures, and they're going to wait and see, and then see if those measures can be then further extended, further loosened, further adjusted. And we believe this is a prudent approach. And I think you'll see all countries in Europe eventually doing that. But as I said, each country is in a different stage of its epidemic. And at this point, I think it's really important that we don't start to compare countries as to where they are in the lifting of these public health and social measures. We have to look at the situation they're in and how they're dealing with their unique situation.
Thank you very much, Dr. Ryan. Next question comes from Chile, from Eduardo Teletrece. Eduardo, can you hear us?
Yes, thanks. Hi, I'm Eduardo Wolf from Teletrece. Thanks for your time. Here in Chile, a card will be applied for recovered patients from COVID-19. The government says that this patient stop infecting the rest of the population. We know that it is a measure that is also analyzed in other countries. My question is, what is the WHO opinion on these measures? Is it recommended? And should a PCR test be required to deliver this discharge card? What is the international experience like? Thanks.
I will start, and Maria will follow up on the technical side. WHO does not have a position on this approach. I think what we do have is advice for countries to be very prudent at this point. Number one, we need to be sure that what tests would be used to establish the status of an individual. And there's lots of uncertainty around what such a test would be and how effective and how performant that test would need to be. And secondly, a lot of the preliminary information that's coming to us right now would suggest that quite a low proportion of the population have actually seroconverted. So it may not solve the problem. There's been an expectation maybe that herd immunity may have been achieved and that the majority of people in society may already have developed antibodies. I think the general evidence is pointing against that and pointing towards a much lower seroprevalence. So it may not solve the problem that governments are trying to solve. And then thirdly, there are serious ethical issues around the use of such an approach, and we need to address it very carefully. We also need to look at the length of protection that antibodies might give. Nobody is sure whether someone with antibodies is fully protected against having the disease or being exposed again. Plus, some of the tests have issues of sensitivity. They may give a false negative result, and we may actually have someone who believes they're seropositive and protected actually in a situation where they may be exposed, and in fact, they are susceptible to the disease. Now, it's not that these tests cannot be used, but there's a lot of work to do to standardize those tests, to ensure that they're validated, to ensure that they're used as part of a coherent policy, and that there's a very clear public health objective to their use, and that they are not misused in any way. So We will look at what Chile is doing or proposing to do. We will look at what all countries are proposing to do, and we will offer the best advice we can based on science and ethics to them. Maria?
To supplement, yes, this is an ongoing issue, and we will be issuing some guidance over the weekend on this because there are a lot of countries that are suggesting to use rapid serologic tests to be able to capture what they think will be a measure of immunity. And as Mike has said, right now we have no evidence that the use of a serologic test can show that an individual is immune or is protected from reinfection. What the use of these tests will do will measure the level of antibodies, and it's a response that the body has a week or two later after they've been infected with this virus. And these antibody tests will be able to measure that level of seroprevalence, that level of antibodies. But that does not mean that somebody with antibodies means that they're immune. And so we will be issuing some guidance around this because it is a confusing area. There's a lot of tests right now that have flooded the market, and that's a good thing. It's a good thing that these things are being developed and that they are available, but we need to ensure that they are validated, and so that we know what they say that they attempt to measure, they are actually measuring. So we hope to put some guidance out over the weekend, and that guidance will be updated as more information becomes available.
Thank you very much. From Chile, we go to India. Anuj Kumar from Legal Desire Media. Anuj, can you hear us?
Yes, can you hear me?
Yes, please go ahead.
Yeah, thank you for taking my question. So there is a complete lockdown in India as a day before. Prime Minister of India extended the deadlines till 3rd of May. So for the reason in lockdown, internet is a main source of information and socializing. A challenge is that a lot of COVID-19 fake news regarding medicines, treatment, origination stats is spreading across social media. So can you please elaborate on what measures have WHO taken with social media platform like Facebook, WhatsApp, Twitter to tackle such fake news, and search engine like Google to remove search listing of such pages with fake news?
So I could start, and perhaps Mike or Didi would like to supplement. We've been working with a large number of platforms, and Google and Facebook, and I'm gonna list them, but I'm gonna forget to name them all, with Viber and WhatsApp, to make sure that information that is put out is accurate information. We have been fighting this infodemic since the beginning. There's a lot of information that is out there that is inaccurate, and we're working very hard to ensure that when someone searches for COVID-19, that the first thing that comes up is a reliable source. And that would either be a WHO website or national websites, and so that you can find accurate information. And so when you search, you find the latest accurate information because this is an evolving field. It is confusing out there because unfortunately, sometimes the misinformation gets circulated more. So each of us has a responsibility that when we see something and we see something that is false or we think something is false, we don't pass that on. That's our responsibility as well. But we're trying to ensure that we address the myths, we address the inaccuracies. We have something up called Mythbusters, where we hear about rumors, potentially rumors that could be damaging and harmful to health. We address those head on to make corrections, and we try to get that information out as quickly as possible to ensure that when you do a search, that all of the platforms will give you the reliable information first.
And if I can supplement, our EpiWin platform, our information network for epidemic, also provides direct access to many, many communities around the world, religious and faith-based communities, to working communities, to commercial communities, all over, in many, many places. And we have channels for each and every one of those areas in which there are webinars and there are interactive sessions in which we engage with civil society at all levels, all around the world. But I also just would like to say, because we never ever get a chance to do this, is to really thank our media and social media teams. They're the silent heroes of our response and have engaged and understand that we don't go after the messenger. What we try to do is make sure that we replace bad information with good information. And that's as important in fighting a virus as any frontline health worker. So chapeau to our teams who do the silent work.
I just would like to add to that. India has actually a strong capacity to help in this. It can play a big role in fighting infodemic. And as Maria and Mike said, we're partnering with Google, Facebook, and others. And we would like to use this opportunity to act not only at the global level, but at the country level. But taking into account India's capacity will be really good. And as I said earlier, we would like to reach out to India directly using Hindi. Mujhe Hindi nahi aate, but at least we would be able to send messages and partner with India to fight the infodemic, which is actually causing lots of problems and blocking millions from getting the right information. So we call on India to partner with us, use this opportunity because of its capacity to fight infodemic, because it has a big capacity. Thank you.
Thank you very much. From India, we go to the US. We have Stephen from Radio World, PRX, if I'm not mistaken. Stephen, can you hear us, please?
I can hear you. Can you hear me?
Yes, please go ahead.
Oh, perfect. In Yemen, you'll know that the first COVID-19 case was identified a week ago. And since then, there have been reports of contact testing, but no other cases have been identified. What do you think Yemen needs now to fight the pandemic, and what do you know is being done?
WHO continues to support all communities in Yemen. We've put in place, or are supporting, local health authorities and agencies in implementing case finding and contact tracing, and using polio teams and other teams to do that. And yes, we have not detected further cases, but that is not to say that that has not occurred. We are constantly fearful of disease exploding in places like Yemen or in Syria or in Iraq or in many of the fragile states in which we work, in which many people have been displaced, many people are living in overcrowded conditions. So we have to remain very much on alert. But what's even, I won't say more important, because it's difficult to say something is more important than COVID-19 right now, but for many of these communities, they have direct, real and present dangers in their lives. And there are pregnant women who need to give birth safely. There are children who need to have infections treated. There are elderly or older people who need to have chronic diseases treated. And therefore, preserving life-saving interventions, preserving feeding programs, preserving humanitarian interventions is just as important. So while we work to try and contain COVID-19, we have to remember that these people are in desperate need in many, many countries and have been abandoned for years. And many agencies, including our own, work with local communities and with governments to try and ease the burden on these people. And again, Dr. Tedros launched the humanitarian appeal for COVID-19 a number of weeks ago now, and we do thank all countries who've responded to that call. And we thank Mark Lowcock and his team on the humanitarian side, and all our humanitarian partners for their untiring efforts to continue providing services, UNICEF and others, in these situations. So we are concerned, we are alert, but we're also aware that these populations face many more difficulties than COVID-19, and we must continue to provide essential services to them, regardless of the other situation, the political or conflict situation in those countries.
Thank you very much. Next question is Agence France Presse, Nina Larsson. Nina.
Yeah, hi, and thank you for taking my question. I wanted to ask you, I see that, sorry, I'm just trying to pull up my question here. I see that US President Donald Trump said earlier today that he believes China's coronavirus total is far higher than admitted. And this came after the Wuhan revised up its death toll by 50%. I was just wondering how confident WHO is in the numbers you've currently been provided by China, and what ability do you have to actually verify them? Thank you very much.
So I'll start, and perhaps Mike or Gigi would like to supplement. So we are aware of new numbers that were reported overnight from China, which added an additional 325 cases and 1,290 deaths from Wuhan. And this was done in an attempt to leave no case undocumented. What we understand is that they've used an existing law of statistics to find these cases. And what they did is they reviewed different databases. They looked at the database that is kept for all of the confirmed cases. They looked at their funeral service systems. They looked at hospital systems. They looked at laboratories to see if there were any duplications or if there were any cases missing. They looked for cases in fever clinics and hospitals, detention centers, and elderly care centers as well. And what they have reported is that the discrepancies in these cases were due to a number of factors. First is that the healthcare system in Wuhan was overwhelmed at one point, and some patients died at home. Secondly is that medical staff were delayed in reporting of these cases because they were focused on providing care for those patients and they didn't fill out the forms in time. Next is that there were additional locations that were built. And if you remember, in Wuhan in particular, some of the hospitals themselves were overwhelmed. And so they set up these makeshift hospitals that they called them, which were essentially stadiums and other facilities where they put mild cases to be cared for. And in those situations, the reporting wasn't done in a timely manner. And so those cases were added. And in some situations, the reports weren't filled in completely. And so what they did is they did a review of that and they revised their numbers, and those were the numbers that were updated overnight. It is very important to know the numbers of people who have died from COVID-19 because this is of public health importance. And it is important that we have the accurate reporting of this. And in such, WHO has developed some guidance around this, which is for their international guidelines for certification and classification of COVID-19 as a cause of death. And this is based on ICD codes that exist. And our primary goal is to support countries in their ability to classify people who have died from COVID-19. And I just want to say that this is something that is a challenge in an ongoing outbreak, to identify all of your cases and to identify all of the deaths as an outbreak happens, especially if systems are overwhelmed. I would anticipate that many countries are going to be in a similar situation where they will have to go back and review records and look to see, did we capture all of them? I've seen a number of reports from media where people have been, in a number of different countries, where people have died outside of a hospital system. And so it will take some time for those individuals to be classified. So it is important that cases that do die from COVID-19 are recorded, and we've provided some guidance to support countries to do so.
Thank you, Maria, and thank you for the clarifications there. But we would also like countries to be as fast as possible in that process. And I know that it's somewhat forensic to go through these processes, and everyone wants to be sure. But it's really important that we understand the size and scale of the pandemic as it moves forward. And the use of a probable case definition or others where you can, in a sense, say, yes, this was probably a COVID-19 case is better. I would commend the authorities in New York, for example, who've announced a list of, or a number of probable deaths, which gives a much better sense of the impact of the epidemic. And it's that kind of speed with doing that. Those numbers may change over time, but I think it's always better when people put forward the data that they have as early as possible, because that keeps us on top of what the impact is and allows us to project forward in a much more accurate way. So I think, as Maria said, all countries will face this, but I do think it's important that countries provide that data as quickly as they can in the interests of moving our collective efforts forward to control this pandemic.
Thank you very much on this. Next question is Gabriela Sotomayor, our friend from from Geneva-based Press Corps. Gabriela, please go ahead.
Thank you very much, Ty. Thank you for giving the question. It's very nice to see you all. And I have a question. I want to come back to the issue of Taiwan. We hear more that more criticism on Taiwan being excluded from COVID-19. They have very few cases and they can offer their experience to the world. So I would like to have your comments on this and well, it's just that. Thank you.
So I will start. So just to say, I will repeat what I said the other day. We have been working with colleagues from Taiwan on the technical side from throughout this pandemic. And you're right, it is important that we learn from all countries who are dealing with COVID-19. I've personally, myself and Steve, have briefed members from Taiwan CDC, public health professionals and scientists, where we've had an exchange of information about what is happening at the global level in different regions, and also from Taiwan as well. And we have a number of people who are serving in our clinical networks and our infection prevention and control networks. And again, it's an opportunity where we regularly meet through teleconferences, where there's the opportunity to exchange information peer to peer. And this is invaluable to be able to have firsthand experience with patients. To say, how are they developing disease? How can we treat them? How do we prevent onward transmission? And so there has been a regular and open dialogue throughout the pandemic.
Thank you for the question, and thank you, Maria. Yeah, just to add that, as we've said before, there's two parts to this. There's the participation within the WHO governance process, within, for example, the World Health Assembly. And that's an issue that member states of the organization decide. The WHO staff does not have the mandate to decide those issues. WHO staff works technically and operationally to fulfill the mandate of WHO to coordinate, to convene, to provide advice, to furnish assistance for the response. That's the work of WHO staff. The decisions about participation in the governance processes, in the membership in the Health Assembly, is a decision that is and belongs to member states. But within the technical work that we do, as Maria has made clear, there are a range of areas that we cooperate, work with, engage with Taiwanese experts, both within the context of this current pandemic and generally. And we listed those, and they're available on our website. I think just again to remind of three of the key ones for the response now. There is a point of contact within Taiwan CDC that has access to the International Health Regulations event information site. This is the key platform for exchanging information among all the parties and stakeholders in the International Health Regulations. There are two of the key clinical networks that Taiwanese experts participate in, the Clinical Management Network and the Infection Prevention and Control Network. These networks meet at least once a week, sometimes twice a week. And there is the direct contact between WHO at a technical level, Maria just mentioned these, and Taiwan CDC. These are very important to ensure an exchange. We are looking at other ways to do so as well as this evolves and as the expertise from wherever can contribute to the response efforts. So I hope that answers the question about the technical work that is ongoing and the area that is really in the hands of member states, the formal participation of in WHO governance bodies like the World Health Assembly.
Well, maybe I could just add to this, because I think it is important the health authorities in Taiwan and Taiwan CDC deserve praise. They've mounted a very good public health response in Taiwan, and you can see that in the numbers. And we have praised that, and we've seen similar approaches taken in Hong Kong, SAR, and across China. And we are observing, and we are watching, and we are bringing Taiwanese colleagues into the networks, the technical networks, so they can share their experience, and they can both contribute their knowledge, but also seek new knowledge from outside. And I do believe that health experts from Taiwan CDC were involved in one of the initial missions in China with colleagues from Hong Kong, SAR, as a joint mission to Wuhan by the National Health Commission in Beijing. So that there, as Steve has said, these kinds of scientific collaborations without China are extremely important. But Taiwan health authorities, Taiwan CDC, professionals and health workers in Taiwan have stood on the front line. They've served and they have done service to their populations, and as many others have around the world. And from our perspective, we all stand with our professional, scientific and health colleagues everywhere.
Thank you very much. Now we will go to Simon Ateba from Today's News Africa. Simon, can you hear us?
Yes, I can hear you. Thank you for taking my question. My name is Simon Ateba from Today News Africa, and my question is on Africa, not just sub-Saharan Africa. We know that the cases have escalated in the past few days. We have almost 1,000 deaths now. We have more than 17,000 cases. So is there anything that we can do in sub-Saharan Africa at this moment that containment seems to have failed? And if I can quickly add something also, here in the US, we have in the past 72 hours, we've had 11,000 deaths. We've had almost 100,000 new infections. At the same time, we hear authorities saying we are almost reaching the peak. So my question is, when can countries know that the peak is close or has been reached? Thank you.
Dr. Tedros may wish to speak to his, he did speak in his speech to his engagements with the African Union and leaders across Africa, which have been very intense. I know our regional director for Africa, Chidi Moeti, has been deeply involved, as have our teams. We have mounted, I think, 38 surge team support missions, in addition to the presence of WHO in every country in sub-Saharan Africa, in every country on the African continent. Actually, we have mounted 38 surge missions in sub-Saharan Africa. You will have heard that have sent now, I think, the third shipment of supplies through the Solidarity flights in collaboration with the African Union, with Africa CDC, with Jack Ma Foundation, and with the World Food Programme. So supplies are reaching countries in Africa in growing amounts. The DG referred to the fact that all African countries now have the capacity to test. Some countries, like South Africa, Kenya, and others, are developing high-throughput diagnostic capacity. And can congratulate Kenya on being able to implement that extremely quickly. And there are very good reference facilities and reference labs on the African continent at NIC and CD in South Africa, at Institut Pasteur in Senegal, at Kemri in Kenya, Uvri in Uganda. So there are real capacities across Africa to do the job that needs to be done. There's a deep history of containing epidemics, a very strong polio program across Africa. Now, there are the advantages that Africa has, but there are constraints, and you're absolutely correct. These are difficult, this is a difficult disease to contain. Not on camera is our Assistant Director General, Dr. Sose Fa, who spent most of the last year and a half in the front lines fighting Ebola. As I've said previously, in Ebola, in the peak of the epidemic there, we were tracing 25,000 contacts a day effectively in the middle of a shooting war, and to the great testament to the bravery, courage, professionalism of Congolese frontline professionals. So I believe that African countries can achieve much more than maybe people from outside expect, but African countries need support, they need resources, they need solidarity, they need supplies, and they need the transfers of technology and knowledge that will allow them to take the fight to the virus. And I believe many countries in Africa are doing that. And we don't believe that at this point the disease has passed the capacity to be contained. We believe a lot can be done to mitigate the impact of the virus. And we believe that we need to accelerate those efforts as the number of cases grows on a daily basis on the continent. Like with all our member states, we will stand with African countries and stand on the front line and fight the virus together. But the DG may have some comments to make at this point. No.
If I might add, I wanted to just touch upon something that you said when you talked about containment and that it was no longer possible. I just want to echo something that Mike said. Containment is possible. Containment is possible of this COVID-19 virus. We have seen in a number of countries now, not just in Asia, in a number of countries across Europe, that we're facing this horrible outbreak where they brought it under control. And Africa has an incredible resilience that Mike has outlined in terms of its ability to fight infectious diseases and to mount a response, to find cases, to care for cases, to engage communities and build up communities and empower communities to be able to fight this. And so I was a little worried in what you said. I don't want you to lose hope. Containment is possible. It's gonna be a hard fight, but we are here and our African regional office is there and our country offices are there and the whole world wants to help. We need to do more. We need to empower everyone with the ability to test and to find cases, to have treatment centers available so that people can be cared for appropriately, to make sure that we practice physical distancing, to be able to have hand washing stations where we don't have running water. There's a lot that we can do, and I just wanted to highlight that containment is possible. This virus is containable.
Thank you very much. We have a time maybe for one, eventually two questions. If we are very fast, we go to our friend John Zagacostas. John.
Good afternoon. I was wondering, can you hear me, sir?
Yes, please.
Yes. Good afternoon. Coming to the comments of Dr. Tedros earlier on introducing strict disciplines on wet markets when they're reopened, we've been through this debate before with SARS, with Avian, calling for good animal husbandry, and there have been some exemplary examples to my knowledge, and Vietnam has been one of them. And how much is Vietnam's very good performance in this pandemic due to that very, very good animal husbandry?
Hi, John. We miss you at the press conferences. I think, well, obviously, Vietnam deserve praise for anything they do to manage the animal-human interface, but in this particular case, their performance in containing the disease has been in relation to imported cases in humans. So in that sense, I wouldn't believe that necessarily, it's probably protecting Vietnam from other diseases, but at this point it's been the public health action and the action of the government with an all-of-government approach that has led to a pretty good performance in controlling the spread of the disease. With regard to the broader issues in terms of markets and other things, we have work to do. A lot of work has to be done at the national level. A lot of work has to be done at the international level. It needs a One Health approach. We have a tripartite arrangement with our colleagues at OIE and FAO. But this is what many have been speaking about for many years. We live on one planet, and we need a One Health approach. And threats to human health in the main come from the animal kingdom, or epidemic threats, emerging diseases and zoonosis. So managing the interface between animals and humans is extremely important, and that interface has been stressed by climate variability, by environmental exploitation, by the illegal trade in wildlife, and many, many other factors. And like those other things like climate change, it's not that possible to deal with simplistic There's no simple way to deal with that. It requires a complex, again, all of government response. It requires an approach to regulation that doesn't drive things underground. It's really important at this point that we ensure that right now around the world there's a lot of illegal trade in wildlife. We need to be very, very sure that markets are safe, they're well regulated, they're well run, but as the Director General has said, many, many millions of people get their primary source of nutrition from such markets. How do we make markets safe? How do we make markets do their job, which is provide nutritious food for people in a manner which is safe? And that's going to require a very deep discussion between countries, within countries, and across sectors in order for that to happen.
I would like to add to that. My background is in emerging diseases and zoonotic pathogens. These are viruses that jump from animals to humans. And I was very fortunate to spend almost 2 years in Cambodia, almost 15 years ago now, where I was working at Institut Pasteur, and I was studying avian influenza, H5N1. And what we were doing is we were working in the markets, and there are hundreds of researchers, maybe more than that, in the area of Southeast Asia that have looked at markets and have looked at animals in the markets and where do those animals come from? Where are they onward sold? How are they sold? How are they sold in a safe manner to keep the people who are working with those animals, to keep the people who are buying those animals safe? What we have learned from the sale of animals in markets is that there are safe ways to do this. And that you're right, what we learned from Vietnam, what we've learned from Cambodia, what we've learned from Thailand, what we've learned from China in terms of the safe operation of these markets needs to be carried forward. It needs to be done better, and it needs to be done better at a global level. And we work very closely with FAO and with OIE, and we have guidance on how these markets can be operated safely to ensure that we prevent and we minimize the opportunity for these viruses to jump from animals to humans. So there is a long way to go there, but we have learned a lot over the years with avian influenza, with SARS, and we still need to learn about COVID-19 and the zoonotic origins of COVID-19.
Thank you very much. So I'm looking at time, and Director General has an important call to go to. So unfortunately, we will have to conclude here. But obviously, we will see you next week. We do apologize to many journalists who, again, were online and were not able to ask questions, but we are trying really our best. If you have questions that you need answers immediately to, please send us an email to media@who.int. We will have an audio file sent to you shortly, and transcript, as always, tomorrow. I wish you a very nice weekend.
Okay, thank you so much. So have a nice weekend, bon weekend, and see you on Monday. No, see you at the concert actually tomorrow evening, Geneva time, but I think it will be a morning somewhere, afternoon somewhere. So see you at the concert, and I would like to use again this opportunity to thank Lady Gaga and all the artists. Thank you so much.